Currently in Canada, for patients who have previously received an immunomodulatory drug as well as a proteasome inhibitors, the options are either pomalidomide or daratumumab. Pomalidomide with dexamethasone is currently funded in most, if not all, provinces in Canada, but daratumumab is not funded. So this limits our options in terms of what we can get through the government. Regardless, this is a very important area which needs further exploration. In this patient population, one of the more important things is to determine how fit they are, as well as to determine how good their organ functions are, specifically related to whether they have adequate hematological function, renal function, and performance status. And this will help me determine what to give. Obviously, with pomalidomide, this is a drug that's extremely well tolerated. So for most of these patients, they should be able to tolerate this drug. But importantly, pomalidomide does have some side effects, including hematological toxicity, and this must be kept in mind before using this drug. The purpose of this study was to determine how well patients who had previously received lenalidomide-based therapy and had progressed on this treatment would tolerate pomalidomide-based treatment in terms of safety and efficacy. So in this study, patients had to have one, but a maximum of 2 prior lines of treatment, but have had to progress on lenalidomide. This study has 2 parts to it. The first part is where patients were given pomalidomide and dexamethasone alone. The second part of the study is where people were given pomalidomide and dexamethasone with daratumumab. So for this specific part of the study, I'm focusing more on the second arm, which is where they get pomalidomide, dexamethasone, and daratumumab. The efficacy results of patients who received pomalidomide, dexamethasone, and daratumumab is quite impressive. More than 70% of patients did respond to this treatment, with more than 25% having at least a very good partial remission. So I was quite impressed with these results. Overall, patients did tolerate this combination quite well, but the most important safety signals were that there was an increased rate of neutropenia, which is not surprising given that pomalidomide does cause neutropenia. And coupled with this was that there was an increased rate of infections. But overall, this combination was extremely well tolerated. What I believe this tells us is that you have to watch the blood counts of a patient on this treatment closely, and if they do have any signs of infections, that they need to be treated. But overall, they'll tolerate this quite well, and they'll have a very good efficacy with this treatment. For patients who may be eligible for this treatment, I think this is extremely encouraging, because what it does tell us is that this combination will be effective. This combination will also be well tolerated, although you do have to watch out for infections as previously mentioned. The hope is that eventually this combination will also be approved and funded by the provinces, such that patients who have failed a proteasome inhibitor as well as a lenalidomide-based combination can receive this treatment and derive the high efficacy and improved progression-free survival with this combination.